There is now a way you can have access to urgent care without ever having to leave your home. HSHS Medical Group is now offering virtual medical care. Joining me now to discuss it is Jeaneene Gesell and Noel. Good morning to you both.
Good morning, Melanie.
Okay, where did the idea for this come from, virtual medical care? I certainly could have used this last week when I was doing battle with my illness.
Well, HSHS Medical Group, we have over 80 locations, and we cover anywhere from Springfield all the way to Belleville. And what's really happening right now is there's a primary care shortage. So people are really having a difficult time getting into their primary care, and especially in the rural communities. These patients really are waiting days and days to be seen. Their only options are to try to get into a priority care or, in some cases, go into an ER. So we thought launching something like virtual care would be really good for the medical group to provide access to care for patients, especially those in rural communities who just don't have the time to wait.
And sometimes you just don't want to get in the car and drive and sit around other people who are ill and, you know, just things like that. What are some of the things that can be discussed during a session, an online session with a doctor?
Well, some of our top diagnoses are UTIs, URIs, upper respiratory infections, especially this time of year. Sinusitis is #1 right now as far as what our doctors are hearing.
Wow.
And then a lot of things around rashes, skin rashes, pink eye, poison ivy over the summer was big.
Okay. And this is a private session with a doctor, right? Obviously, because you're at home, and I guess they're uninterrupted as well. How long do these sessions typically take?
Well, once you've registered online or by phone, it's about 10 to 15 minutes you'll wait, and then a doctor will call you back over FaceTime or Skype. And then the average visits takes around 15 to 20 minutes. So from the time you register to the time you have a diagnosis and a treatment plan, and if necessary, a prescription, it's about 20 minutes, 20 to 30 minutes.
So about the average time that you would sit face-to-face with a doctor?
Correct.
Okay.
You just don't have the wait time up front.
Up
to see the
front,
doctor.
yeah, all that. What are the hours for virtual medical care? Is it certain hours during the day, or is it 24 hours?
It's a great question. It's 24/7 patient access to a provider. That's why we actually call our website anytimecare.com, because anytime, night or day, it doesn't matter. You know, just log in, or you can go to our application on either an Android or an iPhone and download that app for free. And I will tell you that when we launched this, the very first call we got was at about midnight, and it was from a mother who was concerned that her child had something wrong with her eye. They used the virtual care to diagnose pink eye.
And how long ago did you guys launch?
We launched in May.
In May, okay. So you could do this over the phone, cell phone as well. I'm thinking laptop,
Absolutely.
maybe.
No, you can do this through a traditional phone. You can do it through a smartphone, computer, or a tablet.
Okay. How much is the virtual visit, and do you have to be insured in order to see a doctor online?
Well, first, you do not have to be insured. It's a flat fee of $29 for each visit. And we do provide a receipt at the end if you want to turn it into your insurance, but that's how we can keep it affordable. We collect the money up front, either from a credit card, debit card, or a Benny card.
And you guys do write prescriptions as well?
Correct.
You do, okay. Sounds like an excellent program. Jeaneene and Vince, thank you so much for being here today. Again, they are with HSHS Medical Group. Interested patients, you can access virtual care by visiting anytimecare.com.